So as we enter the harsh winter months, our nation is experiencing the biggest industrial strike action in years. Thousands of N.H.S. operations and appointments have been cancelled already, and up to 100,000 members of the Royal College of Nursing are expected to walk out on Thursday. So I'm asking, should we postpone the strikes as a result of the bad weather? Joining me now is political commentator Emma Webb and Socialist Party industrial organiser and trade unionist Rob Williams. Good morning to you both. Rob, you've been out on the picket line this morning. Do you support all of this disruption?
Well, I support the strikes. I'm over here in West London now, so sorry about the noise, but supporting low-paid care workers. The issue is, isn't it, I think your reporters just said, the amount of staff shortages that are in the NHS on a daily basis, the operations that have been cancelled. Don't forget, no health workers actually taken action yet. That's the norm in the health service. So the question should be asked, isn't it? The onus is on the government here. It's not about health workers postponing their action because of the disruption. It's really that the government should be getting around the table and negotiating a pay settlement that's, you know, tries to keep in line with the cost of living crisis with these health workers. The government met the health unions yesterday and refused to talk about pay. It's absolutely ridiculous. So that's what needs to be done.
Emma Webb, let me bring you in. It didn't look good that Steve Barclay even refused to discuss the issue of pay with Pat Cullen from the Royal College of Nursing, did it? What's the solution here?
Well, look, I think even the Labour Party is saying that the pay rises that are being demanded here are unreasonable and unaffordable. And it's the same as with the rail strikes. Whenever you enter into negotiations, you have to start from the perspective, and the first starting point needs that you need to be making reasonable asks. And these pay rises, a 19% pay rise, is just simply not reasonable. The British people were asked over the last 2 years throughout COVID, out of solidarity, to protect the NHS. And now that we're entering into this cost of living crisis, this cold snap where people will be at home, not able to afford to turn on their heating, old people falling over and not having ambulances come and pick them up, not being able to take public transport because those are also striking, taxis not arriving because of the snow. This is straightforwardly putting people's lives at risk. It's against the Hippocratic Oath. I frankly think that it's unethical. And so when it comes to negotiations, I think the government will be absolutely right to not only to say that these strikes should be postponed. It's not for us to say that, but I think that from the perspective of those who were striking, they shouldn't be striking at all. I think it's against the interests of patients. And I'm sorry, but I don't buy the idea that this isn't going to affect patient care, because if it wasn't going to affect patient care, then striking would make no sense at all.
Rob, back to you.
Look, this is the first strike in England and Wales in the whole history of the Royal College of Nursing. The union leaders in the health unions have shown this week that they are willing, you could argue, that they're desperate to avoid the need for members to go out and strike. These aren't workers who want to take action this week. They've been driven to this. The person there mentioned about COVID, don't forget who's in the front line in COVID. Don't forget who's health workers. Many of them were put in huge risk. Many of them, unfortunately, didn't last the pandemic, put themselves on the line because of the general good in society, cared for a very ill Prime Minister, don't forget, during that. And what is their thanks? These are workers that have lost a fifth of their income in the last decade. A fifth of their income. That's how much they've lost. And the pay rise that they're being imposed on them goes nowhere near the cost of living rate at the moment. Real inflation is over 14% at the moment. These workers do not want to take action. Unfortunately, they've been driven to it by this pay squeeze, by this cost of living squeeze that is taking place.
Emma, the health workers were applauded, but they weren't genuinely thanked for their efforts. Do you agree with that?
I don't think anybody would disagree with the need for them to have an increase in their pay. I think everybody is suffering at the moment. Everybody could do with a little bit more money in their pockets. One of the reasons why they're not going to, by the way, is because the government are taxing everybody up to their eyeballs. So, I think we can agree that nurses shouldn't be going to food banks, that nurses do need a pay rise. But also we need to consider the fact that the general public this is why I mentioned the solidarity that we were asked to show with the NHS, because the general public are suffering hugely at the moment. It's not just nurses who have not had their pay rise in line with inflation. Everybody is suffering. And the money that goes to pay those salaries comes from the public purse. It comes from those increases in taxes. So, that's the reason why I say we have to be reasonable when we're talking about how much money is being demanded here. And as I said, even the Labour Party has said that 19% is an unaffordable pay rise. The problem is that the NHS seriously needs reform. Even Wes Streeting himself has said this, that we need a national health service, not a national health shrine. We need to be getting value for money here, and we're not. We need to reform the health service, because at the moment we're just throwing endless amounts of money into a black hole, and it's not helping the situation. So yes, those who are the least well paid within the health service, like nurses, should be earning more money, absolutely. And maybe some of that money should be redistributed from those who are in roles like equality, diversity, inclusion, and in management positions, when clearly the management of the NHS isn't exactly efficient.
Rob, do you think the healthcare workers would have some sympathy with what Emma was saying there? Actually, some unity with what Emma was saying there, in that the NHS needs to be redrawn and its parameters changed so that the funds are redistributed more fairly?
Listen, I think the reform that Emma wants is the total opposite to what nurses want. They will be to introduce much more of the market, reintroduce, all the private sector, privatisation. We've had that. We don't want that. And it's an absolute scandal, by the way, that New Labour really are covering up for that and legitimising those issues. It is a scandal that Labour isn't supporting the strikes and, really doesn't appear on the side of health workers. However, the majority of working class people are. And I would appeal to them, show the support, because I know this strike is going to be a strike that is going to be well supported. If you're out and about tomorrow, go to your nearest hospital, support the health workers who are taking action, and also all the other workers. On Monday, yesterday in Northern Ireland, it was a Northern Ireland-wide health strike. So the words of Emma are the failed policy of the last couple of decades, the red herrings about diversity. What a red herring that is. The reality is that we have hundreds of thousands of health workers who are taking action reluctantly, and they not only need a pay rise, they also want to defend the health service from people like this who want to ruin it and give it over to the private sector. That's where all the money's going, by the way, to the hands of the privateers and the profiteers. Get them out of our NHS, support the nurses.
OK, thank you both. Emma Webb and trade unionist Rob Williams there. Let me know what you think. gbviews@gbnews.uk.